Good morning or afternoon, depending on where you are in the country, and welcome to the Disaster Distress Helpline Pre-Application webinar. We are extremely pleased that you are interested in the Disaster Distress Grant, and at times we may call it the DDH. My name is Captain Mary Ann Robinson. I am the Director of the Division of Trauma and Disaster Behavioral Health, where the DDH grant resides. Our division is part of the Center for Mental Health Services within the Substance Abuse and Mental Health Services Administration, or SAMHSA. As we get started, we have a few housekeeping items. Please note that your cameras and your microphones and your chats, if not already, they may be disabled during the presentation so as to avoid distractions or background noises. The webinar is being recorded and will be posted to our YouTube channel, SAMHSA's YouTube channel, within a couple of weeks, if not sooner. And an email will be sent to all those who registered when that application webinar is available for review. While we anticipate the content will address many of your questions, we will provide contact information at the end of the webinar for your convenience. Now for a few brief introductions. Joining me today to share some of the details about the Disaster Distress Helpline Grant are Ms. Evelina Tarrin. She's the coordinator for the Division of Trauma and Disaster Behavioral Health, and Ms. Eileen Bermudez. She's the supervisory lead for the Division of Grants Management in the Office of Finance and Resources within SAMHSA. Today's presentation will cover funding details, program purpose, key personnel. We'll look at the required as well as the allowable activities. We'll also look at eligibility, data collection, performance measures, and performance assessments. We'll look at the requirements, content that should be included in your application, and how your application should be formatted. Much of this information, of course, is on your NOFO or in your NOFO. We will highlight several things that we think would be important for you to be aware of.
Thank you, Captain. So going over the funding details, the funding mechanism is a cooperative agreement with anticipated total funding available at $1,953,000 per year for an anticipated one award funded up to 5 years. The application due date is June 15th, 2026 at 11:59 p.m. Eastern Time. The expected award date is September 1st, 2026, and the expected start date is September 30th, 2026. There is also no cost sharing or matching required. So, the proposed budgets cannot exceed $1,953,000 in total costs, direct and indirect, in any year of the proposed project. Annual continuation awards will depend on the availability of funds, grantee progress in meeting project goals and objectives, timely submission of required data and reports, and compliance with all terms and conditions of the award. All activities proposed in your application and budget narratives must align with the current executive orders or the EOs, SAMHSA strategic priorities, and SAMHSA's Dear Colleague letter on harm reduction. The program purpose of the Disaster Distress Helpline is to provide immediate, confidential, and accessible emotional support to individuals experiencing distress related to natural and human-caused disasters. Your organization is expected to establish and maintain a DDH that provides 24/7 toll-free confidential crisis counseling to individuals in the U.S. and its territories experiencing emotional distress related to natural and human-caused disasters. Services are designed to be available before, during, and after disaster events, supporting both acute and longer-term emotional recovery, and are provided at no cost to the public. The key personnel for this cooperative agreement include the project director or the PD, program coordinator, the PC, and the evaluator. The PD must oversee the day-to-day management and operations of the grant to ensure goals are met, all reports are filed on time, and all rules are followed. The PD must be one individual at one full-time equivalent or FTE and 100% level of effort. The program coordinator or the PC must oversee the day-to-day management and operations of the backup DDH. The PC must be one individual at least 0.5 FTE or 50% level of effort. The evaluator will oversee the development of a plan to ensure continuous monitoring of all DDH activities and collection of all required data, report findings to SAMHSA, and ensure data will be used for quality improvement. The evaluator should be one individual at least 0.25 FTE or 25% level of effort. The required activities include to establish and maintain and manage a national disaster distress helpline, provide 24/7 disaster-related crisis counseling accessible to all individuals, maintain a trained and supervised crisis counseling workforce with expertise in disaster behavioral health, develop and maintain a library of disaster-ready public education materials and templates to support timely and consistent messaging to the public, ensure operational readiness and continuity, develop and implement a plan to evaluate DDH operations to improve project performance and increase understanding of factors that contribute to program success, and coordinate all activities and efforts with SAMHSA and Disaster Technical Assistance Center DTAC. The allowable activities are not required. However, your organization may propose to fund for the following activities: expand communication modalities, pilot or enhance additional communication options, such as web-based chat features or asynchronous messaging to improve access to disaster distress helpline services that are subject to SAMHSA approval, responder-focused support enhancements, implement optional service enhancements to outreach efforts focused on first responders, disaster workers, healthcare providers, and public health staff, and other personnel affected by disaster-related stress, and technology and systems enhancements, improve internal systems related to call routing, reporting dashboards, quality monitoring, or accessibility features that enhance service delivery and operational efficiency. Additional allowable activities include evaluation enhancements, conduct optional analyses, lessons learned reviews, or service utilization studies to supplement required evaluation activities and support continuous quality improvement. And partner with SAMHSA 988, Suicide and Crisis Lifeline, SAMHSA Training and Technical Assistance Grantees, and other HHS and federal operating divisions and grantees, such as the Health Resources and Services Administration and Administration for Strategic Preparedness and Response, to further DDH goals and provide education and outreach about DDH capabilities and services.
Thank you, Evelina. And so we'll look a little bit at the eligibility. Eligible applicants are domestic, public, and private nonprofit entities, including states, territories, tribes, health facilities, public or private nonprofit organizations. Please note, if you are a nonprofit organization, you must provide documentation of nonprofit status in attachment 8 of your application. Also note that agencies or organizations in any of the categories need to do their due diligence to confirm before applying that they have authority under the law in their state to establish and maintain a disaster distress helpline. You must collect and report data and document your plan for data collection and reporting in Section D of the project narrative. Discretionary awards should include clear benchmarks for measuring success and progress towards relevant goals. The recipient is required to submit programmatic progress reports that demonstrate whether you are meeting the objectives you've selected for this project, achieving the outcomes you anticipated, and whether any changes need to be made. You must review your performance data to find out if you are making progress and improving project management. One other note, again, just to highlight that this grant will not collect client level data. Recipients will be expected to report on project level indicator on SPARs or in SPARs on a quarterly basis, such as the number of mental health screening encounters, the number of supportive services screening encounters, the number of contacts linked to behavioral health crisis services, the number of brief intervention encounters for mental health, the number of individuals referred to mental health or related services, the number of callers accessing services of the DDH, and the number of mental health awareness and promotion messaging impressions. You will receive training and technical assistance on SPARs after the award. The data you collect allows SAMHSA to report on key outcome measures. Performance data may be reported to the public. You may also be expected to provide quick turnaround, monthly, and ad hoc reports to DDH on DDH call volume, social media efforts, and other activities related to specific disasters or traumatic events. And we have some examples that I'll just read for you of the type of monthly indicators that may be required. Daily call volume, the state from which the call was received, number of connected calls, number of dropped calls, for example, abandoned rates, average call duration, unique callers, callers who are thinking about suicide, number of times when emergency rescue procedures were initiated, specific disaster responding to. So that's whether it's from the state or that you're responding to. Because we have seen that there are instances where there may be two disasters occurring or three disasters occurring at the same time. The answer rates, the average speed of answer and the wait times, text volume, or other measures as directed by the government project officer. These grants are being awarded as cooperative agreements because they require substantial post-award federal staff participation in the oversight of the project. Under this cooperative agreement, the roles and responsibilities of your organization and SAMHSA staff are to comply with terms and conditions of the cooperative agreement, coordinate with SAMHSA staff when responding to disasters, obtain approval from SAMHSA staff before planning for or implementing significant changes to DDH operations or communications, submit performance measures data via the SPARS system, submit all required program performance reports, data, financial reports, and continuation award applications, attend and take part in calls with your government project officer or GPO, attend and participate in virtual meetings. Your GPO is responsible for program monitoring, providing technical assistance, and conducting site visits. Your GPO will work with you on implementing program and evaluation activities and make recommendations about program continuance. Your GMS or grants management specialist within SAMHSA's Office of Financial Resources is responsible for ensuring your project is complying with all applicable federal laws, regulation guidelines, and the term and conditions of the award. They will frequently participate with the SAMHSA GPO on monthly monitoring calls. SAMHSA staff will schedule routine conference calls, provide technical assistance and consultation, oversee publication of project results, as well as packaging and dissemination of products and materials to make findings available to the field. If needed, help will help the SAMHSA staff will help develop a selection process for subawards or review recipient contracts and awards. Staff members will recommend outside consultation for training, evaluation, and data collection. They will also coordinate with the DDH staff when responding to disasters. They will help with granting needed approvals requested by DDH staff before planning and implementing significant changes to the DDH operations or communications. Okay, we will now transition back to Evelina.
Thank you. Now on to the merit review of the project narrative. The following instructions should be considered as you develop the project narrative. The project narrative cannot be longer than 15 pages in length. There are 4 sections, A, B, C, and D, and you should use the section letters and numbers and headings listed in the evaluation criteria. Please do not combine 2 or more criteria or refer to another section of the project narrative in your response. Reviewers will only consider information included in the appropriate numbered criterion. The number of points after each section heading is the maximum number of points a reviewer may give for that section. And unless required, cost sharing will not be a factor in a review of your response to the criteria. So for section A, the focus is intended audience, population of focus, and needed statement, worth 20 points and approximately 2 pages. Section B, proposed implementation approach. The proposed timeline cannot be over 2 pages and should be submitted in attachment 4. It's worth 40 points and approximately 7 pages. Section C, organizational experience and staffing, worth 25 points and approximately 4 pages. Section D, data collection and performance measurement, worth 15 points and approximately 2 pages. For the application submission, the applications are due June 15, 2026, and applicants are required to complete 3 registration processes, including System for Award Management, or SAM, or SAM.gov, grants.gov, and ERA Commons. If you have already completed registrations for SAM and grants.gov, you need to ensure that your accounts are still active and then register in ERA Commons. Information about the application process can be found at How to Apply for a SAMHSA Grant. When your application is submitted, it must pass validation checks for both grants.gov and ERA. You will receive emails from both systems to either confirm the application successfully passed validation checks or to notify you that there were errors that must be fixed before the application can be processed successfully submitted, can be considered successfully submitted. If using the grants.gov workspace tool, use the preview grantor validation feature in grants.gov before submitting your application. Doing so will allow you to validate your application and review and fix all errors and warnings before submitting. It is strongly advised that organizations log into ERA Commons account post-submission to confirm submission status, as emails from each system could be placed in a recipient's junk email folder and go unread. Please do not wait to start all of these processes. The registration process can take up to 6 weeks. If you believe you are interested in applying for this opportunity, start the registration process immediately. While it says that the process can take up to 6 weeks, that's very atypical. And also, grants.gov will reject electronic submissions from applicants with expired SAM registrations. And so we will now transition to Eileen Bermudez, the supervisory lead with the Division of Grants Management.
Good morning, and thank you again for participating in this pre-application webinar. My name is Eileen Bermudez, and I am a supervisory lead grants management specialist with SAMHSA. I will be presenting the grants management overview of your application requirements. The information you will find on here will be helpful as you're working through the application. So you should keep it handy and use it as a point of reference. On this slide, we'll discuss the following topics. The following topics will be discussed. Go to the next slide. We have included the application guide link, which can be found and embedded within the notice of funding opportunity, which we like to call the NOFO. Please review the application guide as it includes helpful and pertinent information related to this NOFO and the application process. It's extremely important to read through the guide in its entirety. The resources on this slide will assist you with the regulations, policies, and policies applicable to the SAMHSA grants. Many policies have been updated, including the HHS grants policy statement, the 2 CFR 200, the executive orders, and SAMHSA's priorities. Please ensure your grant application aligns with all policies and regulations noted in the NOFO. Ensure that you thoroughly read the NOFO for specific requirements. Factors affecting allowability of cost. Your proposed budget must contain only allowable, reasonable, and allocable costs as defined under the 2 CFR 200, 403, 404, and 405. As a reminder, per the NOFO, the estimated awarded amounts, Evelina went through them. I won't sound repetitious, but I'll read it a little bit again. Annual funding limits of up to $1,953,000 per year. This will include costs, direct and indirect. Continuation funding. Annual awards are subject to availability of funds, progress toward project goals and objectives, timely submission of required data and reports, compliance with all award terms and conditions, and alignment with SAMHSA, HHS, and administration priorities. On this slide, we have included the links to the budget template created by SAMHSA. It's highly recommended that you use the SAMHSA PDF budget template to complete the detailed budget and narrative justification required for the submission of your application with the application. SAMHSA's budget template includes a wealth of helpful tooltips and resources to assist and guide you with the preparation of your budget. The budget template was created with extensive grant recipient consultation and input and designed to avoid common budget preparation pitfalls. Use of SAMHSA's template will reduce errors that can delay the review of your budget. All applications must include a detailed budget with narrative justification that explains the federal and non-federal expenditures. Your budget must be consistent with and support the project narrative. The budget narrative and justification must be concrete, specific, it must provide a justification for the basis of each proposed cost in the budget and how that cost is determined. Detailed budget breakdowns must be provided to facilitate the determination of whether the costs are allowable, reasonable, and allocable. Avoiding common issues with the SF 424A. These budget errors are listed for your reference, but they are much easier if you understand the visual aids that are coming up. In section A, budget summary, row 1, input the NOFO number in column A. The column A is labeled grant, program, function, or activity. And in column B, enter the federal assistance listing number as shown in the NOFO. In section A, budget summary, also row 1, enter the federal requested amount in the subsection new or revised budget under column E. This will populate the amount down to row 5, the totals row. In section B, budget categories, use column 1, and that section is also labeled grant program function or activity subsection, to break down your costs by budget categories. Note that the cells circled in green must match up. The validation here is to make sure that your total entered in section A matches the total cost in section B, broken down by each category. In addition, the budget category totals from your detailed budget narrative justification must correspond with each of the budget cost categories in section B of the 424A. Since this example does not require match funds, section E may only be applicable if you have in-kind contribution. Section D is where you break down your forecasted cash needs by quarter. You will need to take the total you entered in section A and then break it down based on your cash needs into 4 quarters. Section E is for the future funding periods. This part gets a little confusing. Note that column B, or the first column, is for the first future funding period, which is essentially your second budget period. Similarly, column C would be for your third budget period, and so on. Section F is for other budget information and is optional. Key personnel, as Evelina went over in her slides, project director, at least 100% level of effort, program coordinator, 50%, and the evaluator is expected at 25%. Both key persons, all 3 personnel positions must be listed in the detailed budget, even if there aren't any federal funds being requested for these positions. The individual that you identified as the project director for the grant must have the PI or principal investigator role in ERA. Only one individual with the principal investigator role can be designated as contact to take actions and receive notifications in ERA. If the PD position is being filled by a contractor or consultant, please include a copy of the agreement in your application that specifies the official relationship and addresses performance of all the required duties and responsibilities. Ensure that you include your organization's current negotiated indirect cost rate agreement or cost allocation plan in your application packet. If your organization is opting to use the de minimis rate of 15% of modified total direct costs, then a clear statement must be made to that effect in your IDC narrative of the detailed budget. Please refer to the NOFO. There are several funding limitations, restrictions for this project, which include food is not an allowable expense. Capital infrastructure, such as computer systems or softwares, are recoverable as depreciation through an approved negotiated indirect cost rate, or the 15% de minimis, in accordance with your organization's existing capitalization and amortization policies. Funds may not support racial preferences or discrimination, policies denying the biological sex binary, illegal immigration activities, activities that compromise public safety or conflict with federal priorities. Funds may also not support harm reduction, as it is outlined in SAMHSA's Dear Colleague letter on harm reduction. Nor funds may not be used for housing first policies that fail to ensure accountability and fail to promote treatment, recovery, and self-sufficiency. You must also comply with SAMHSA's financial management standards and funding limitations found in Section G of the application guide and adhere to all applicable federal anti-discrimination laws. Any questions? If you have any questions, you can consult the following.
Yes, thank you so much, Eileen, and thank you, Evelina. We hope that this webinar has been helpful. And as we move forward, I'd like to just recap that the most important next step is for you to remember the application deadline. All proposals must be submitted by June 15th at 11:59 p.m. Eastern Time. We strongly encourage you to allow sufficient time to complete and review your application, as late submissions will not be accepted. And as Eileen mentioned, the emails that you see on the screen, please use those email addresses and points of contact if you have any questions about this webinar. Thank you again for your attendance. And as a reminder, the webinar will be posted on our YouTube channel and a link emailed to you when it becomes available. If you have registered, we hope that you registered for this session. Thank you and have a great rest of your day.